So far, how do you see economic impact in Thailand first?
Unfortunately, I think most economists now do agree that we are facing a global recession. We are already in a global recession, and it's going to today. IMF, International Monetary Fund, came out to say that it's going to be probably at least as bad as the global financial crisis that we have experienced in 2008, 2009. So about 10 odd years ago. 2008, 2009. So about 10 odd years ago. In Thailand as well, yesterday, I think Bank of Thailand came out and surprised quite a lot of pundits that came out with a new forecast for GDP of minus 5%, more than minus 5%, which will be one of the worst, since the Asian financial crisis. And we are facing recession both globally and also in Thailand. And I think that's something we shouldn't be panicked about, but we have to accept that reality and also brace for the impact, because this is going to be a very difficult proverbial war that we have to fight, not only against the virus, but also the massive economic downturn that's going to affect a lot of lives.
People who will bear the brunt of the suffering will be people with low income and so-called gig workers who depend on daily wage, right?
My biggest concern is absolutely, you're absolutely right, is that it's not only the overall economy is impacted, but where it's impacting the most. And I think the people with less wealth, with less cash position, who's less shock absorber, so to speak, these are the guys that's going to be affected the most. So we are talking about the small and medium scale enterprises. We are talking about people who are in an informal sector. We are talking about lower income people. And it's all connected because if you think about the people who cannot afford to work from home, people who need to be out there and meet people like taxi drivers, these are people in informal sector. They may not benefit from a lot of the welfare system that we have. Their jobs, they need to be out there meeting people, and that means two things. One is that social distancing is very difficult for them. They cannot work from home. But it also means that they can also spread, if they get infected by the virus, they're also more likely to spread the virus further to other people, which complicates the efforts to fight the virus spread as well. So it can cut us in many ways, both inequality, the economic downturns, but also the war against the virus itself.
But this is the dilemma that is facing not only Thailand, in most other countries which are trying to introduce it work from home approach, are also trying to tackle this problem. UK, for example, is a big problem there also. So how do you think we can learn from some of other countries how to deal with this situation?
That's a great question. I think that the two things to execution. So I think where we can learn from other countries is we can see definitely that there's a lot of focus on trying to almost, for lack of better words, almost pay people to stay at home. So that's to pay people, so subsidize the companies so that they don't have to fire the workers, and give them enough sufficient funds so that they can stay home, so they can survive without having to work. And I think that's a very important lesson that we see everywhere around the world. Now, the more difficult part about Thailand compared to the UK or the more advanced economies is that the advanced economies, most workers and firms are in a formal sector. So it's very easy to identify them. They already have some kind of system, whether it's employment provident fund, central provident fund of some sort that you can help. But in Thailand, I think around half of people actually are not in a formal system. So we don't have a great data on them. So the question of how do we target these people? How do we help them? That's going to be the key challenge. I think the principle we can apply, but we have to be more creative in thinking about how do we really get to help people who are in the informal sector.
And do you see the capacity of financial institutions like World Bank or IMF are quite okay in terms of supporting many countries around the world, or should governments of each country just try to rely on themselves first?
That's a very good question. I think there's no doubt that we need global collaboration at this time, because again, I'm back to the point that this is a very unprecedented kind of economic downturn, because it's not only the war against the economic downturn, but it's also the war against the virus at the same time. And the way the virus spread in a world which has become hyper-connected is very rapid, and it requires a lot of collaboration, a lot of communication. And honestly, I think that's what we are lacking right now. We don't have enough global collaboration. That's why we're in the situation we're in right now. So I believe both in terms of healthcare, health policy, both in terms of economic policy, there needs to be greater coordination. There needs to be greater communication rather than just solving each individual country's crisis. But right now it's very difficult because I think we enter this outbreak, not at the best position, not in a position of strength globally. And right now everybody is just basically putting out fire in their own country, too busy to just helping each other.
But do you expect China to try to play a leading role in helping countries like Thailand absorb the impact of this deadly virus? Should be a good opportunity for China to play that role, right?
Yeah, I think so. And I think you start to see that they start to do that. And in some ways, it's a reciprocation as well, because I think many countries also stepped up to help Thailand, stepped up, help China as well during time troubles. So right now, China is getting a bit better. It's a bit advanced in the cycle. So now it's passed on a lot of the knowledge and know-how to the rest of the world as well. And you can see that not just for Thailand, but also in Italy, where situation is very severe. China is really stepping up and trying to help them. So I think that's really a good move in the right direction. I think we need to see more of that. I think this is time where we probably have to put the politics aside and really, appeal to the humanity rather than the politics.
You said we should put politics aside, but what do you think about global politics or global economy when the world coming out of this crisis? Will global politics still remain the same?
Yeah, it really depends on how we handle the crisis. I think what I can say is that the world that we're entering is going to be different from the one that we were in before the COVID crisis. It's definitely going to be different. Whether it's going to be a more collaborative one where we appeal to humanity and we have greater collaboration and we start to see that it's really, we are fighting a lot of common threat against humanity, whether it's a virus, whether it's a climate change issue. That's one possibility. It's a one I want to see. I'm not too optimistic. But of course, you can also have another world where it's just become more fragmented and more distrust, and you start to question the connectivity of the world, right? Because some people start to think that whether we have this spread of virus, is it because the world is just too connected, it's just too integrated? Should we rethink our mode economy? So I think question against globalization is going to come up after this as well. But if you trace back any question against globalization, it's always rooted in inequality problems. So if we handle inequality and we get out of this economic mess in inclusive policies and really help the people who need it most, then I think we should be okay. But if we neglect that, then of course the wave against globalization is going to get stronger after this.
I mean, stop calling the pandemic a Chinese virus could be a good start for the countries that want to reach out to each other, right?
Yes, that's almost a necessity.
You also mentioned that social distancing can create social inequality. So what can be immune, or what can be the tool to fight against this social inequality?
So what I'm arguing for is social distancing is crucially important, of course. You need to do that in order to flatten the curve and make sure our healthcare system is not overwhelmed. But social distancing causes pain points, and that pain is different for different people. And we have to recognize from that perspective, what are the barriers to social distancing? One of which is I already spoke about, which is the nature of jobs. Some jobs, I think Bank of Thailand just did a study, which just came out today, saying that about 63% of people actually cannot really do work from home. So it's just a nature of job that you need to specialize machines, or you need to be close to your customers. But there's also other problems. Some people, it's not so much that problem, but it's that maybe that they don't have the digital know-how, they don't have the digital skills and literacy. Maybe for their job, it's okay that they can actually do things remotely. They can work from home, they can use Zoom, they can sell on e-commerce, but maybe they just don't know how to do it yet. So for these people, the policies that tackle the issue will be very different. So it's not going to be so much just giving cash handouts. These are going to be how do we educate them? How do we explain to them that this is an opportunity and give them the right knowledge and know-how so that they can actually try and learn new ways of doing business. So I think you have to really go into different groups because they all might have different problems in a way that keep them away from the social distancing.
Yeah. And Khun Thepchai and yes.
The coronavirus is not just a disease. I think it's a test of the system that we have to go through.
Absolutely, I really like what the foreign minister. I really like what the foreign minister Viviana Balakrishnan of Singapore said. That it's really a test of three things. One is the healthcare system capabilities. One is social capital. So it's not just about government, it's also about people and social cohesion. And it's also about ability to govern by the government. So you need the three pillars to work together. If one of which is become the weakest link, then the virus will attack that.
Let's see how Thailand will handle this test.
Yes. And
Khun
Thepchai and Dr. Santitarn, we always have this kind of story whenever crisis happen in Thailand, the story of unsung heroes. So I'd like both of you to take a look at the same time about during this kind of difficulty, how a group of Thai people always are willing to help others. Because during the time of coronavirus crisis, apart from doctors, nurses, and medical staff, we can see a group of volunteers helping others. And ThaiPBS will talk to a restaurant owner who provide food for hospital staff every day during the corona crisis. The restaurant owner said he's very happy to do this even though it's exhausting. Moreover, it's not money that they get, but it's real happiness that she feels that she can attain from helping others. The group of volunteers normally provide food for hospital staff twice a day for lunch of 600 boxes and dinner of 600 boxes. It costs about 36,000 baht a day. This amount of money she gets it from other volunteers who want to support her duty. She pointed out that this time is really important and we have to help others as much as we can to get through this crisis together because we are in this together. And ThaiPBS World will try to have this kind of story of unsung heroes or heroines during this crisis. And Dr. Thonsorn and Khun Thepchai, are you still with me?
Yes, we are.
Yes, we are.
So that's quite regular story for Thai people, isn't it, during this time of crisis?
Yeah, I think, it Prime Minister himself, Khun Prayut, said yesterday that the pandemic could be ravaging, many countries in the world, but it in no way can diminish the good hearts of the Thai people. I think he's right in saying that, yes.